Well, as far as I know, I think Tracy's sorting that one out. Yeah. No, she's done it before. Yeah, that'll be absolutely fine. Yeah. Okay, I've got to go. All right. Thank you. See you later. Bye. Hi there.
Hi.
How can I help?
Yeah, I'm here for a meeting.
Got a meeting. Do you know what the meeting is?
It's about my child.
Do you know who you're meeting with?
Social worker.
Okay. Can you just remind me of your child's name? Sorry.
Yeah, Jackson.
Do you know what time that meeting is?
Well, I think it's like 5 minutes.
Ah, yeah, I see it. Safeguarding meeting. Okie dokie. Right, if you'd just like to have a little seat there, and I'll just let them know that you've arrived. Okay.
Okay, thanks.
Hi, Agnes. Just to let you know, we've got Jackson French's mum in the waiting room here. Oh, actually, I see the social worker now. Yeah, perfect. All right. Thank you. I'll let them know. Thanks.
Okay.
Agnes just running a little bit.
Oh, yeah. Leanne,
Hi.
how you doing?
Hi. Yeah, not brilliant. It's been quite a morning, to be honest.
Oh.
I've got a doctor's appointment. I finally managed to get a doctor's appointment for today. And yeah, I can't be in two places at once. So to be honest, I don't even really know what this meeting's about.
Okay.
So
Okay. I'll tell you what. Well done, you. It sounds like you've got a really hectic day ahead.
Yeah.
Traffic's awful, isn't it? But you're
Yeah,
here.
yeah,
That's the important thing. You're here.
Okay.
I'll tell you what. Let's go in to the meeting room, and I'll explain everything before the others get there. Okay. So don't worry.
Okay.
Is it okay to
Yeah,
go
I'll
through
put
that?
you through. It's fine. Yeah, like I say, I'm just running a bit late, but I'm
I'll take the bag for you.
Yeah, thanks.
You know the way, don't you?
Yes, that's fine. Come on then, Leanne. We'll have a way through.
Okay, thanks.
Right. Just take a seat. Now, is there anything in particular that I can help you with now to help you feel less concerned?
Yeah, I mean, it's not anything kind of, it's just, it all feels a lot more serious now. So it's just,
Right.
you know, and I'm, it's the doctors really.
Mm-hmm.
Like, you know, it took me ages to get the doctor's appointment. I got the doctor's appointment, and now.
Yeah. Well, look, it's absolutely brilliant you've got the doctor's appointment, because that was something that we'd highlighted as being important, wasn't it? So, what time?
Yeah, it's like trying to spit myself.
Yeah, I can see it's a really busy day. So, what time would you have to leave to make sure you can make that appointment?
I mean, really, I'd have to get away by about 10:30, like no later than that. Yeah.
Okay. Well, look, what I'm going to do is I'm going to explain to people that we're going to just have a short meeting this time.
Okay.
And that you need to get away to go to the doctor's appointment, which, as I say, you know, it's very important.
Yeah.
It's great you've got that, so we don't want you to miss that. And then we'll reconvene and go into more detail about how we're getting on about all the things that we looked at in the first meeting.
Right, so I can definitely leave at 10:30.
Definitely
it's not going to run over.
No, no, I'm going to keep an eye on the time, and you will get away at 10:30.
Okay.
Okay.
Oh, yeah.
Now, if you remember that the last, this is a follow-on from the last meeting.
Yeah.
So most of the people that were there are going to be the same people today.
Yeah.
This is all about supporting you. Okay, so please try not to worry.
Okay.
All
I mean, yeah. Okay.
So shall I go and get the others in now, and we'll get cracking, and we'll just cover whatever we can today.
Yeah, let's just get on with it.
Okay, right. Won't be a sec.
Okay.
Right, first of all, thanks very much everyone for coming, and welcome to what was going to be the second meeting of the Child in Need meetings. I want to say at the outset though that Leanne has managed to get a doctor's appointment for the baby for later this morning, which is
that's great.
It's great, isn't it? Yeah, that's really good. But it does mean that we're going to call the meeting. I'm going to call the meeting to a close at 10:30, so that Leanne has a chance to get there. Because it's very important, isn't it? It's part of it. So I plan for us to get as far as we can in the time available, and then we'll reconvene in a couple of weeks and have a fuller review of where we are against the action planning that we did at the last meeting. Is that all right, everyone? Yeah, great. Okay. Now I'm going to take some notes, so don't mind me. I am listening, honestly, not doodling. And I think it would be helpful, first of all, if we just do quick introductions and remind everybody who we all are. Leanne, do you want to start?
Yeah, I'm Mum.
Great. Yeah, that's
Hi, I'm Agnes, and I'm the safeguarding lead for the school, and I've known Leanne and the family for the last few years.
Thank you, Agnes.
I'm Christine. I'm the health visitor for Violet, and I've been involved with the family for a few months.
She's being so good today, isn't she? Oh, that's lovely.
Yeah, I'm David Johnson. I'm the probation officer for Chris, and I was asked to come to provide an update for the risk assessment.
Yeah, thank you, David. Thank you for coming.
I don't really understand. No offence to you at all, but I don't really understand why he's here. Like, this is supposed to be about the children. I get why these guys are here, but like, I don't have anything to do with Chris anymore. So
Right. Okay. Well, look. Hands up.
Sorry, if you don't mind, I'm just going to move around so I can hear you.
Oh,
a bit
yes,
better.
please do. Please do. Please do. Look, Leanne, hands up. I apologise. I should have explained to you before that David would be here, so apologies for that. But can I just clarify why I've invited him? And that's because Chris is coming up to release in the next few weeks, I think, isn't it?
Yes, only a few weeks.
And we have to keep our focus on the children and what we need to consider if there's any restrictions or any safeguards that we need to put in place to protect them with Chris coming back into the community.
do you want me to turn my phone on?
Perhaps it would be helpful if you could.
It's just in case I.
Yeah, all right. Are you with me on that?
Yeah, that's fine.
Because what
okay.
happens to Chris may well affect the plans that we put in place for the children.
Yeah, okay, yeah.
Yeah?
Yeah, that's fine. Yeah.
Well, thank you for that. Thank you, David. Okay, so let's make a start. Right. Okay, I think it would be useful just to very briefly recap on the situation. I know it's difficult going over old ground and can be difficult for parents, but only briefly, but just so that David, who wasn't here before, knows where we got to and where we are really.
Yeah.
We got involved a couple of months ago due to some concerns over Jackson's school attendance, some mental health issues for Leanne, conditions at home, and medical appointments for the baby. So we can have a look at where we are with those issues in a second, but can I just reiterate again that I think with Chris's history of violence and with him being released in the next few weeks, it is also important that we hear what's happening there, and that you hear it, Leanne, firsthand, and that we can see how this may impact on the children and what we're trying to do there. Now, you've been doing well catching up on these medical appointments, as we've already noted, and I'm sure you'll be able to say a bit more, Christine, in a moment about what's happening at home. But just initially, Leanne, maybe it's helpful if you can say how you feel generally about how you think things have been going since we last met in this forum.
Yeah, like, fine, I guess.
Generally okay, you think, in the right direction? Yeah. Good.
Well,
Good.
things have been going a lot better, Leanne. During our last visit, Violet's put on a little bit of weight, which is good.
Good.
And we've have an appointment to see the social prescriber in the next coming weeks, which is well. And also we're going to be doing a review of Violet in the next week.
Oh,
So
lovely.
things are going well at the moment.
Great. Great. That sounds positive, doesn't it, Leanne? Yeah. Okay. And what about Jackson then?
Jackson's been good, so it's been good to sort of see him, and like his attendance has sort of been a little bit better as well. It's just sort of some reminders about being late. That's the only thing, but it's good that we're seeing a little bit more of him. And just a
He
little.
hasn't really like since the last meeting. I think he's been late once.
It's just having to say a few reminders on like sort of being punctual and being on time, as well as yesterday he just forgot his inhaler, so that's quite important for him to have on him.
Yeah, I get that, but like mornings are. I mean, I've got the baby, and you know, like.
Yeah.
There's about a million things to remember. I know inhalers are
course.
important, but like there's a lot of other lots of
I tell you what, can I ask, Agnes,
Yes.
that you can provide us with some information for
And
the
of
next
course, a bit more
meeting?
detail. Yes.
A bit more detail. When are we talking about Jackson being late,
Yeah.
and how late? And how late?
So once.
Yeah.
I'll
So
get
we
the
know
exact
exactly what we're
figures.
looking at. That would be a good idea, I think. And then maybe we can talk a little bit more about home routines and such like. Sound okay? Great.
Yeah.
Leanne, can we talk a bit more about how you feel things are going, the progress that's being made? Maybe think back to the first meeting we had, and compare to then. Would you say you feel things are the same now, or there's been some improvements?
I'm
And
so sorry.
that's okay. Anything you need to check, or
Can I just?
yeah,
No, it's fine. Sorry.
okay, or whether things are improving, or if you think some things feel more difficult. If you could just give us, say, a bit more in those terms, that would be helpful.
Yeah, I definitely feel like things are getting better. You know, I mean, it's been really stressful getting to appointments and things. I'm not going to lie, especially, you know, and just generally, obviously having a baby is hard. But yeah, I mean, me and Richard are really pleased that Violet's tummy problems are being looked into. That feels like a positive step.
Yeah, that's good. Is there anything particular that's on your mind that's worrying you at the moment? Something that we could hopefully help you with, or give you a bit more support with?
Well, Chris is the biggest concern.
Right.
You know, knowing that he's getting out soon, obviously you start thinking, is he going to be turning up sort of at the house making trouble based on past experience?
Yeah. David, anything you can
Yeah,
say in
and
that
I think that's
respect?
where I can go and give you a bit of reassurance, really, why I'm here today. I'm really sorry to hear about your concerns, and it must have been really hard, considering his behaviour in the past. But I will look at protective measures that can be put in place, especially around the children. And that hopefully will give you some confidence that, and reassure you.
Yeah, I think we have to recognise that Chris has always been a part of Jackson's life in some way or another. Well, what do you think Jackson feels about his dad? Oh, I think that's come. Hello, Pat.
Hi, sorry.
That's
I just
okay.
need to grab Agnes. I'm really sorry that she's here.
Oh, no worries, Agnes. I'll send you the minutes.
Okay, thank you
Yeah.
for that. I hope it goes well, yeah.
Bye.
Okay. Bye.
Bye.
Sorry.
Now, what I was saying is, what do you think Jackson feels about his dad?
I mean, yeah, he does talk about him, like when he goes to Chris's mum's, he does come back talking about him quite a lot. You know, I think unfortunately he would want to see him. I don't. But
Well, I think we can't stress enough that the restrictive measures for Jackson's safety and baby and himself is paramount, but we have to consider Jackson's feelings towards his father as well, don't we? So that's an area that we've really got to work on. Yeah.
have the other thing is, like, we've been doing quite a bit of work on Jackson's bedroom. Richard's been kind of getting it sorted, so you could probably come and see it next time on your next visit.
That's it, yeah.
I have to say that is a positive thing for Richard to be doing.
It's
And
just
I
a
know
shame,
on
like,
my-
sorry, I was going to say it's just a shame that, like, Richard's not here to tell you about it himself, really.
And I know on my previous visits, I've seen what you've done downstairs. It's made a positive change, and as I said before, with Violet starting to put on weight, it's all things that are going in the right direction.
That's it. Okay, I'm conscious of the time. I'm also aware that you're only really here with us today, aren't you?
Yes, yeah.
In person,
Yeah.
David. Are you able to summarise for us what decisions are going to be made soon about Chris's release?
Yeah, I'll go over that now, and hopefully this will give you some confidence. You know, Chris has been in prison many times before, but he's in a situation now where he's likely to be released after the panel meeting in a couple of weeks. Because of the short stay that he's had, we've not really been able to do too much work with him. But what I can say is that Chris has spoken about seeing Jackson, and he does want to sort his life out for his mum. He doesn't want to keep letting her down.
Right.
And he's very keen to find work where he can.
Well, it is helpful to understand more about his situation, but thinking about the past, what do you think helps Chris stay out of trouble, stay out of prison? You know, make some positive changes, because there have been times, haven't there, where he's not been, he's not been involved with the police and courts and so on.
Yeah, I mean, from my perspective, it tends to be when he's engaged in and busy, and clearly finding employment would help significantly in that situation.
To be fair, that is true. Like, he's basically like a child. Like, if he's not kept busy, then he just drinks, gets into fights, like gets into trouble. So if he's working, then that occupies him. So
Right.
yeah.
So perhaps you could confirm for us soon as where we are then with the employment
Okay, yeah.
potential opportunity that might be there.
I'll check and confirm the support Chris is going to get in terms of access to employment.
Yeah.
There's a scheme he's very interested in,
Oh, right.
which obviously is good news.
Yeah.
And also I'll have a look at the restrictions relating to the children. So
Yes, that would be really helpful, because I think it's all the family have got to feel safe going forward.
Don't want him anywhere near me.
No. Well, we'll talk outside of this meeting then,
Okay.
David, as and when, as soon as you know a bit more, and then I will keep you and Richard up to speed on where we are with that prior to the next meeting. All right?
fine.
I'm conscious that you're still a bit worried about this whole process and you know what it means for social services being involved. And it's not unusual for parents to be a bit suspicious of social workers and so on. And I know you haven't always had the best experience in the past. I mean, but I've heard a lot today about the improvements that are being made and that are underway, and about the family and a number of adults that are there supporting the children, including Jackson's grandmother. So I was just thinking, it just occurred to me, what would you feel about having a conversation with her before the next meeting about Chris coming out of prison and how she might support the visits with Jackson and the time
You mean
spent
Chris's
with him?
mum?
Yeah. Would you feel comfortable doing that? Because it sounds like Jackson sees her and you get
Yeah.
on.
Yeah,
you know,
we
quite well.
we do get on okay. Yeah, I guess
Yeah,
I could do that.
that would be good.
Yeah.
It's another angle, isn't it?
Mm.
Okay.
Yeah.
Well, you know, we've all got the same goal, to support you and the children. I'll call you this afternoon and see how it went at the doctor's, and then we'll arrange a meeting with everybody in the next 2-3 weeks. But I don't want to hold you up now. So
Yeah,
thanks everyone. Thanks very much, and thank you, Leanne.
Thank
Let
you.
me help you out to reception with that.
Okay. Thanks.
Thank you.
Can I carry your bag again?
Yeah, do you mind?